Hey, welcome to Wednesday. That means it's time for us to delve into matters medical with our resident GP, Dr. Vicky Skipper. Hello, doctor.
Hello?
You know, I feel like I get so intimidated sometimes by you.
No.
No, I mean, she comes in here with, I'll read it to you. The benefits, okay, this is what I get given. Okay, now I've got to ask her questions about this. The benefits of probiotics in functional gastrointestinal disease. I feel like I'm studying a medical degree here when you come in with some of
I'm
these.
going to explain to you what functional gastrointestinal disease is.
Okay, and then what is the difference? Because I've also heard of prebiotics.
Yeah.
So do you get probiotics and prebiotics?
Yeah.
Okay, so tell me what this gastrofunctional intestinal die hele ding is 'n gemors is.
Okay, so
and then tell me the difference between probiotics and prebiotics.
okay, so functional gastrointestinal disease encompasses everything to do with problems with digestion, absorption, motility, all gut stuff. Okay. There was a survey done in 2019 by the University of Cape Town, and they found that 40% of the population suffers with some form of functional gastrointestinal.
Really? That's high?
So that's irritable bowel, that's constipation, diarrhea, bloating, abdominal pain. I mean, we all have some of that at some point. Also, interesting things like lactose intolerance and antibiotic related diarrhea, stuff like that. So the probiotics are the live microorganisms, the real live gogoitjies in the gut.
Okay.
The microflora that aids in digestion and prevents leaky guts and makes sure that everything works properly.
Okay.
The prebiotics is actually the food for those microorganisms.
But aren't they feeding on your food that's in your stomach?
Yeah, but you give them some extra so they can flourish.
Oh, I see.
That's where prebiotics come in.
Okay.
So they encourage the growth of healthy flora.
Okay, is this a common disorder?
Very common. So as I said,
irritable bowel.
Irritable bowel syndrome is very common, especially in women. We're all irritable.
Yeah, you are. It's not only your bowels that are irritable.
The cause is really actually unknown. There's certain factors that play a role in irritable bowel syndrome. They've seen that the flora of healthy patients differ to those with patients with irritable bowel syndrome. Also, they see inflammation in those patients. So even patients with inflammatory bowel disorders, or even obesity, or even stressed patients, that causes or that seems to play a role, and also patients with altered immune activation. The problem is that therapeutic options is quite disappointing when you want to treat IBS. You know, there's some evidence that probiotics does help. It's challenging though, because every person's microbiome is different. Like my gogos and my tummy is different to yours.
Yeah,
so you know, there's no standard probiotic for all patients. It's sort of you have to sort of a trial and error situation.
What about the inflammatory bowel disorders? I mean, can probiotics help there?
Okay, so now we're talking about Crohn's disease and ulcerative colitis.
And
so they say, look, they're both progressive, destructive diseases. They're very debilitating, mostly looked after by a gastroenterologist. But there is some evidence that it can be helpful in the ulcerative colitis patients. There is, however, some evidence that it's harmful in Crohn's disease. It can actually cause infections. So people with Crohn's must be careful with probiotics. I think for them, prebiotics would be better because it's not like you're giving them live microorganisms, you know.
Okay.
There's some other complementary treatments like herbal stuff, turmeric, fish oils, and even cannabis that they say can help with Crohn's and ulcerative colitis.
Okay. There was something that I was told once by somebody who was lactose intolerant about probiotics. I can't remember what it was. Is there a problem with lactose intolerance and probiotics?
There's not a problem. The thing is, lactose intolerance patients don't have enough lactase, basically the enzyme that digests lactose.
Yeah.
And you can actually help them by giving them probiotics that's got the Lactobacillus acidophilus in. So, and that can help with the digestion. That can definitely help reduce the symptoms and aiding in lactose digestion. And so Lactobacillus acidophilus.
That's a lekker big name for a tiny little chocho that's in your gut.
Yeah.
Is there benefit to take probiotics? If you know, very often when you are when your doctor gives you an antibiotic, they will give you a probiotic with that. Why do they do that? And is there there must be a use for it?
Look, so the antibiotics that we normally give you, they can destroy your good bacteria as well. So you can use the probiotics to basically restore the gut microflora, the good bacteria that's commonly disturbed with your antibiotics. There was a recent review of 33 studies where they found they looked at the incidence of antibiotic-associated diarrhea in children, and the kiddies who were not on any probiotics, the incidence of the diarrhea was about 19%, versus the ones that were on probiotics went right down to 8%. So that's quite significant. Yeah. And they also found that it would reduce the duration of the diarrhea by 1 day. So I think it's definitely I would definitely take probiotics with my antibiotic.
Yeah. Okay.
Yeah.
So now, Dr. Vicky, Professor Vicky.
Oh, if only.
What are the key things that we're taking out here?
Okay, so common reasons for taking probiotics could be irritable bowel syndrome, heartburn, abdominal pain, diarrhea, any of these functional gastrointestinal diseases that we've spoken about. It seems to be beneficial in IBS.
Right.
Okay.
Irritable bowel syndrome.
Irritable bowel syndrome. I think there's definitely benefit when you have ulcerative colitis. Okay. I would not suggest taking it when you've got Crohn's disease. Then if you are lactose intolerant, look out for the microorganism.
Lang naam,
yes,
ek weet nie.
Lactobacillus acidophilus. It took me 2 days to get that right, but anyway. And then there's definitely evidence of probiotics helping with antibiotic-associated diarrhea.
Right. Okay.
That's the summary.
That's the summary.
Yeah.
The summary could have been that one chocho that you have in your probiotic because its name is so long.
So long. All of them are that long, eh?
Oh, really?
Yeah.
And you have to learn all these things.
Well,
yeah, slim there.
I pretend to know them all. I really don't. I Google.
Dr.
And I
Vicky.
practiced.
Yeah, so when you see the doctor like doing this on the computer while they're talking to you, they're actually not writing down your history or what's wrong with you.
We're Googling.
Actually, what they say is they're hitting Google. Dr. Chochel.
Exactly.
Dr. Vicky, thank you very much for your time.
Pleasure.
And thank you for your time as well. Hopefully that's been of interest to you. We'll catch you once again tomorrow with The Travel Show. Bye-bye.